Hi, welcome back to the Gluten Free RN podcast. I'm Nadine Gross-Kowiak, RN, BSN, CEN. And today during episode 24, we're going to talk about fetal development and maternal health. Stay tuned. Welcome back to episode 24 of the Gluten Free RN podcast. Today, I'm going to talk about fetal development and maternal health. Very important and timely topics. Not only am I a nurse, I have a bachelor's of science in nursing, and also I'm certified as an emergency room nurse. And during my time and my tenure as an emergency room nurse, I actually acquired many certifications in my specialty. I was certified PALS, which is Pediatric Advanced Life Support, Emergency Nursing Pediatrics, and also NALS, which is Neonatal Advanced Life Support. So not only was I certified in my specialty, but I was certified for very specific populations, including the pediatric population. What I found in the emergency department is if a sick baby or a sick child came in, everybody ran, not necessarily to the child that was in crisis or in a critical situation. Children scare people, even in the emergency setting. So my take on that was that I had to be extremely good while I was working in the emergency department at number one, recognizing a sick infant or child, and also knowing what to do when there was a critically ill child or an injured child. So not only did I get certified in all of these extra certifications for my job, but I also taught some classes on children and pediatric patients. So I'm very excited today to talk about fetal development and maternal health. Number one, it's near and dear to my heart. I'm a mom. I have two beautiful children, one that I birthed and one that came to us through adoption. And I'm a very, very proud mom of my children. Most recently in the New York Times, there was an article in the newspaper September 21st, 2016, entitled Maternal Mortality Rate in the U.S. Rises, Defying Global Trend, Study Finds. And even more recently on NPR, there's a story entitled Focus on Infants During Childbirth Leaves U.S. Moms in Danger. That's actually dated May 12th, 2017. You can reference these articles on my podcast website. They'll be included as references. So this topic is very timely, and ever since I started to be the Gluten Free RN, one of my goals was to reach women before they got pregnant. So hopefully moms before they became even interested in getting pregnant, so that we could actually identify those that were potentially celiac or were malnourished. Because it's extremely important to have a mom that is able to absorb nutrients so that she can then carry a child or carry a fetus full term and deliver a child that is healthy and thriving. When I was pregnant, when I was 21 years old, many years ago, actually 29 years ago, I was 5'9" 3/4 and weighed 120 pounds. I was very underweight when I got pregnant. I also did not know I was a celiac mom. I didn't have that knowledge. And I talk about that in my book, Donation. I really wish I knew that I was celiac when I was pregnant, because it would have vastly impacted how I ate and what I paid attention to when I was pregnant. Like I said, that was 29 years ago, and I did the best I could with what I knew at the time as an expectant mom. And my son's now 29 and he's quite healthy for all intents and purposes. A lovely man. But I really wish I would have known, because there's the unknown of what would have been different. How would it have impacted our lives in a positive way if I would have known I was a celiac mom before I got pregnant? Alice Bast, who is the executive director of what used to be the National Foundation of Celiac Disease Awareness, actually tells her own story. And it's a story of miscarriage and stillbirths, and a very harrowing story of how she found out she had celiac disease. She saw multiple doctors, the best in the country, and nobody could diagnose her. It was actually a veterinarian that gave her the idea that potentially she was celiac and should not be eating wheat. She went in, demanded the testing for celiac disease, and lo and behold, found out that she actually is celiac. So what we know is that gluten has a negative impact on fetal development and maternal health. I'm also enclosing several other research articles that explain that connection. Ideally, we're going to do a mass screening and we're going to identify all of the people that are gene carriers for HLA, DQ2, and or DQ8. I myself am a HLA DQ2.5 homozygous gene carrier, which means I got genes from each of my parents. That would have been a great thing for my parents to know, not that they would have in 1966 when I was born, but it would have been a great thing for them to know because they both were at risk for celiac disease. And by passing on a double set of those genes, we became super celiacs, which means we, the children of my parents, are double gene carriers for celiac disease proper, which means we are most likely to develop celiac disease and also have a harder time healing from it or recovering completely. So if we don't diagnose women before they get pregnant, and believe me, this applies to men too. Men are gene carriers for celiac disease at a rate 1 in 1. So for every woman that carries a gene, there is a man. So the rate is 1 to 1. The rate of diagnosis is 3 to 1. For every man that is diagnosed with celiac disease, there are 3 women. So we really need to level that out. We need to be looking for the men that actually have celiac disease because a man's genes also impact fetal development and maternal health. So even if just the dad has the genes for celiac disease and he passes them on to the fetus, that will impact fetal development. So it's very important that we do a mass screening, which I'm a big advocate for, at least to find out the people that are gene carriers for HLA, DQ2, and or DQ8. And that could easily be done for every infant that's born in the United States and the world, because this is a worldwide issue. This is not just Northern Europeans. This is virtually affecting anybody wherever you live of any ethnicity at any age. So we really need to be proactive and find people because it can have devastating effects. What we do know is that every generation is sicker the longer celiac disease is not diagnosed, and it takes those kids longer to get better. So those kids are sicker and it takes them longer to get better. So it will take several generations to undo some of the damage that has been done epigenetically, and so therefore future generations will be better the further away they get from having grains in their diet. So I'm not even talking about for my grandchildren, which aren't born yet, or their children. I'm talking a couple generations out. So we really do need to start working on this as soon as possible. So let's just say a woman has difficulty getting pregnant, or she has a hard time maintaining a pregnancy. Frequently, people will look to IVF or in vitro fertilization, which is fertilizing an egg with sperm in a test tube or in a petri dish and then implanting that fertilized egg in a woman's uterus. Here's the thing. If that mom was not able to get pregnant in the first place because she was an undiagnosed celiac disease person, even if you do help her get pregnant through in vitro fertilization, which by the way is very expensive, she's going to have a hard time maintaining that pregnancy. So she's going to be at increased risk for miscarriage, stillbirth, which is fetal death, low birth weight infants, and failure to thrive in those infants. She may also be at increased risk for preeclampsia or eclampsia. Preeclampsia and eclampsia are deficiencies in magnesium. And unfortunately, we do not test for magnesium RBC levels in women that are pregnant. We wait until their blood pressure gets high, over 140, over 90. And typically these women are then put in the hospital and watched, maybe given some medication. But the magnesium is a treatment for preeclampsia and eclampsia. And what we really need to be asking is, why are these women deficient in magnesium in the first place? I remember way back when I was pregnant, we were given a prenatal vitamin. It would look like a horse pill. And what I know as a undiagnosed celiac mom at that point is that I could not break down that tablet. It would just pass through my GI tract, and unfortunately, I would see it frequently intact in the toilet. That should have been a very good indicator to my doctors that I was not breaking down that pill and certainly not able to absorb any of the potential benefit from that prenatal vitamin. We also know that fetal development, or as it's sometimes referred to, fetal growth restriction or low birth weight, is preventable. We actually have to look at the mom's nutrition and make sure that the mom is as healthy as possible when she gets pregnant and even before she even thinks about getting pregnant, so that she can maintain a healthy pregnancy and deliver a healthy baby. Sometimes women find that they are perfectly healthy until they get pregnant or until they deliver a child. Keep in mind that any stress or any change in the body can trigger a gene-positive person, which is the HLA, DQ2, and or DQ8 genes, into the autoimmune component of celiac disease. So any stress can be the trigger into the autoimmune component of celiac disease. Again, a really great reason to do a mass screening, at least for the genetic component that predisposes people for celiac disease proper. I am not discounting at all the fact that non-celiac gluten sensitivity can be much worse for people than celiac disease proper. I actually hold them in equal stance. It's also noted that men are a factor in infertility as far as erectile dysfunction, low sperm count, low libido, or disinterest in sex. So it's very important to evaluate men when there's an infertility issue. It could be a deficiency in zinc, it could be a deficiency in magnesium, or any of the B vitamins, which are very important. And certainly if a man is anemic, why would a man be anemic? It's very important to recognize that, let's say a man is anemic and he has osteoporosis. According to the literature, that man is celiac until proven differently. So all of these men need to be tested aggressively for celiac disease, because there really is no other reason for them to be anemic and have osteoporosis. It's always really sad when people come into my office and they're in their late 40s or 50s or 60s and they've not been able to have children. And they've tried and they've had miscarriages or they've had stillbirths. And come to find out at a later age, they find out that they've had celiac disease their whole life, but never been tested. Again, I can't say it enough. A mass screening only makes sense. The argument against it tends to be that it would cost too much. And really, the cost to society and to our world at large for not diagnosing celiac disease is enormous, not only in health cost, but in decreased productivity, in sickness and death, which is morbidity and mortality. Science Digest published a study in July 27th of 2011 that says first global estimates of celiac disease and its mortality burden. 42,000 children may die every year, essentially from undiagnosed celiac disease, and these are children. So there's enormous cost for not diagnosing celiac disease. I think the cost for not diagnosing celiac disease far outweighs the cost of actually doing a mass screening or screening at least high-risk patients for celiac disease. And in my mind, everybody's high risk at this point. If you look at our populations in general, it's anybody with chronic gastrointestinal symptoms, irritable bowel syndrome, unexplained weight loss or weight gain, iron deficiency anemia, vitamin mineral deficiencies, secondary hyperparathyroidism, unexplained elevations in liver functions, anybody with Down syndrome, Turner syndrome, or Williams syndrome, any autoimmune disease such as type 1 diabetes, lupus, any autoimmune thyroid disease. So when we start to talk about those broad topics, it pretty much does mean anybody, because we're all at risk for those things, those health-related issues. We should not assume that we are going to get sick. We should assume that we're going to maintain our brain health and that we're going to be healthy human beings. But the reality is until we recognize that the food that we are eating is impacting our health in a very negative way, and we change our diet, change our lifestyle, we can then begin to understand how the food is extremely important in not just our health today, but in our health as we get older and then in health of future generations. Very, very, very important information today. For those of you that have not read my book yet, it's called Donation, A Nurse's Memoir of Celiac Disease from Missed Diagnosis to Food and Health Activism. I tell the story of Sam because it was really interesting on several levels, but Sam did not have a period until she was 17 years old. So she had what's called delayed puberty, delayed breast development, delayed menses. She was not developing appropriately. She didn't actually get diagnosed with celiac disease until she was 19. And at that point, they told her that she probably would not have children. Sam ended up getting diagnosed with celiac disease, went on a gluten-free diet and then a paleo diet, and has since had 2 very beautiful boys that are extremely healthy. One was actually walking by 7 months. And when I talk about children born to parents that have been on a gluten-free, dairy-free diet, or at the very best, a paleo diet or some variation of a paleo diet, I say that those children are shiny and sparkly, and the paleo babies tend to be extra shiny and sparkly, which means that developmentally they are on track or ahead of track, that they are brighter and shinier and capable of eye contact at a very young age and interacting with adults and children in a very sweet, lovely way. I am very concerned about this generation of children and future generations of children because they are sicker. They have autoimmune diseases at a much higher rate, cancer at a much higher rate, learning disabilities at a much higher rate. So we really have to look at maternal health, what's going on with pregnancies, what's going on with deliveries. How can we prevent fetal death, maternal death? How can we make people's health better? Because that's what we're all about, right? We want to do preventative medicine. And how do we do that? We really have to look at diet and exercise. And what does that mean? At least it means a gluten-free, dairy-free diet. And if you need to get better faster, or if you're going to get pregnant, please consider being on some variation of a paleo diet. And that does involve animal protein and animal fat. As human beings, we have the enzymes to break down meat, the proteins in meat, and because we have enzymes to break down those proteins, our body can use that protein. It's bioavailable. As human beings, we do not have the enzymes to break down the proteins in wheat, barley, rye, and certain other grains. I myself am on a grain-free diet. I don't even eat very much rice or corn because it's inflammatory. Inflammation is the basis for all disease, and what we really want to do is deal with the underlying cause of that inflammation. Correct the deficiencies that we might have. I myself, as a redhead with hazel eyes, was always anemic. I couldn't donate blood because I was so anemic. My doctors at different times actually suggested that I was anemic because I had red hair. That's really not based in any science. So we have to look for the real underlying cause of the anemia, the deficiencies in B6, B12, and the fat-soluble vitamins, which are A, D, E, and K. We have to test for the magnesium RBC, which is the red blood cell magnesium, not the serum magnesium, if we're going to prevent things like preeclampsia and eclampsia. Those are all extremely preventative ways of testing and preventing things like eclampsia and preeclampsia, which lead to fetal death and maternal death. Zinc is very important also for the development of healthy sperm and sperm motility for men. And so it's extremely important that men be checked for deficiencies in their nutritional panel also. This is not just all about women. This is about the fact that in order to have a healthy fertilized egg, you actually have to make sure that the nutritional deficiencies are corrected. Right from the get-go, nutrition actually has an impact on how well a fertilized egg will develop and also determine whether that mom is going to be able to maintain a healthy pregnancy. Going back to the article in the New York Times, maternal mortality rates in the U.S. rise, defying global trends. So in every other country in the world, especially the developed world, maternal mortality rates are going down. But in the United States, they're going up. That is not a good sign. That's a very bad sign. And the rate that they use is that there were 28 maternal deaths defined as deaths due to complications from pregnancy or childbirth per 100,000 births in the United States in 2013, which is up from 23 in 2005. In this day and age, fetal death and maternal death should be preventable. On the NPR article, Focus on Infants During Childbirth Leaves U.S. Moms in Danger, there's a great quote that says, "With our technology, every single time a woman dies, it's a medical error." I have to agree. We're talking about malpractice. If a woman goes in to give birth at a hospital especially, she should have extra protection from her infant dying and from herself dying. But what we're finding and what statistics are showing is that that's not always the case. Sometimes the hospitals are not recognizing that women are either developing infections or developing complications post-delivery or during delivery and not acting appropriately. And additionally, these women sometimes are delivering their babies prematurely. Now, I think it's great, and don't get me wrong, that we have NICU centers or neonatal intensive care units that are capable of keeping alive these infants that are born at a really early gestational age, like 24 weeks or less. So they're really good at what they do. But what could we be doing to prevent a premature labor and delivery of an infant that I like to say is not fully cooked, has not reached 40 weeks gestation, and is therefore not really viable outside of a womb without very technical critical care in a neonatal intensive care unit? And this is happening more and more frequently. And by a large extent, we are really good at keeping those infants alive that are born prematurely, but they frequently will have lifelong complications and damaged immune systems because they've had early exposure to antibiotics and other medications. Some of these kids are extremely healthy, and that's great, but there's many other children that actually do suffer lifelong complications from a premature birth. So it's very important for society as a whole, worldwide, that we recognize that undiagnosed celiac disease has an impact not only on our generation or our children's generation, but future generations. And this is why it's critical that we actually start doing a mass screening, at least for the HLA, DQ2, and or DQ8 genes, and then very aggressively start to recognize, educate, treat people with a gluten-free diet at the very least, and hopefully a paleo-type diet, because people get better. There's no downside to being on a super good whole-fat diet that includes meat and fish and eggs, fruits and vegetables, nuts and seeds. And people will say, oh, that's so restrictive. There's nothing for me to eat. The reality is there's a ton of food to eat, depending on where you live, and it's extremely nutrient dense. And if you're going to heal the gut damage that occurs in non-celiac gluten sensitivity or celiac disease, you have to take away the thing that is causing the damage in the first place, which is the gluten or the protein in wheat, barley, rye, sometimes oats, or the cross-contamination in oats, and then sometimes, for some of us, all of the grains, if we're going to truly get rid of all of the inflammation and heal the damage. So we know that celiac disease has a huge impact on reproductive health for men and for women, and for children, future children included. So the more information we have, the more powerful we are, the more educated decisions we can make, not just for ourselves, but again, for future generations. So please do research. I've included several articles on celiac disease, reproductive health, maternal health, pregnancy complications, and the World Journal of Gastroenterology paper on reproductive changes associated with celiac disease. It's a good place to start. Read them over, ask questions, make sure you get tested and that you have your family members tested, because undiagnosed celiac disease has a huge impact on fetal development and maternal health. This is Nadine Griskowiak, the Gluten Free RN, wrapping up episode 24 on fetal development and maternal health. Thank you so much for joining me once again. A huge shout out to Tim Hallowell, the podcasting guy, for his superior talents at producing the Gluten Free RN podcast, and also to the Pulse Media Network. My friends Keith Carlson, Kevin Ross, and Elizabeth Scalia, all fellow podcasters and supporters of the Gluten Free RN podcast. You can find the podcasting notes and all of the referenced articles on the Gluten Free RN podcast website. So please, if you like this episode or any of the other episodes, leave a comment. Give me some feedback. Ask questions. Once again, this is episode 24 of the Gluten Free RN podcast, Fetal Development and Maternal Health. I'm Nadine Groskowiak, the Gluten Free RN, wrapping up episode 24. Stay healthy, be healthy, eat healthy. Thanks for joining me, and look for the next episode of the Gluten Free RN podcast every Friday, released at 9 a.m. Pacific Standard Time.